Hello everyone. Welcome to today's video lecture session. In today's video lecture, we'll learn about a topic that is drugs used in shock. Now, shock basically this is a very uh, huge topic, right? Which can be covered in the series of lectures. But in today's this video lecture session, we'll try to cover it at the second MBBS level, right? That points that are required you to understand at this level that we will cover in today's lecture. So basically, what is shock? So by definition, whenever there is decreased oxygen supply as compared to the demand or as compared to the metabolic demand of the body, that particular condition is known as shock, right? In general, we use this word shock whenever there is a decrease in blood pressure, right? Hypotension થાય એટલે that is shock, but actually hypotension itself is not a shock. Hypotension is the result of shock, or it is a feature of shock, right? And actually hypotension develops at the later stages of the shock. Hypotension develop થાય એ પહેલાં પણ ઘણા બધા conditions, ઘણી બધી signs that you can observe in the patient, right, which can be treatable earlier. So exact thing is that whenever there is decreased tissue perfusion, means tissue is not getting the oxygen supply which is required to the tissue, then the condition of shock has been developed. So that is the particular perfect definition of the shock. Now there are various manifestation of the shock and series of conditions or series of you can say series of signs or series of steps that take place in the body, and that will particularly reach to the hypotension. So that is how it develops, right? So first we'll see what are the various types of shocks, then we'll see individual type of shock, what is the brief pathology of individual type of shock, and then what are the treatment options in that particular type of shock that we will learn today in this lecture. Okay, coming to types of shock, basically there are 5 types of shock, right, depending upon the etiology, right? So one is hypovolemic shock, right, then cardiogenic shock, then neurogenic shock, then septic shock, right, and fifth one is anaphylactic shock. Obstructive shock can also be classified in this types, but that is basically the same thing, that is whenever there is obstruction and due to that tissue is not receiving blood supply, that is obstructive. And blood loss, you can cover it into the hypovolemic shock also. So in short, there are 5 types of shock: hypovolemic, neurogenic, septic, cardiogenic, and fifth one which is not mentioned here is the anaphylactic shock. So we'll see one by one shock individually. Okay, then first one is hypovolemic shock. The name itself suggests that whenever there is loss of volume, and due to loss of volume, if tissue is not receiving enough perfusion, then that particular kind of shock is known as hypovolemic shock. Yes, here you can see in this figure that there is the healthy cross section of blood vessels where you can see enough volume. Here hypovolemia is there, not enough volume, right? So that is hypovolemic shock. Now cause of hypovolemia can be so many. It may be due to blood loss, it may be due to loss of volume, means due to dehydration, due to diarrhea, vomiting, whatever may be the cause, ultimately any condition which is leading to hypovolemia can lead to hypovolemic shock. Now what happens in case of hypovolemic shock? Whenever there is hypovolemia, decreased volume, that will lead to decreased venous return to the heart, right, decrease preload, ultimately decrease output, and hypotension, and that will lead to decrease in perfusion to the particular tissues, and ultimately failure of that particular organ. And if the condition persists, then it can lead to multi-organ failure. So this is how the things go on in case of hypovolemic shock, right? So how we can treat this hypovolemia? If you understand that what is this pathophysiology and what are the things to be maintained, then you can easily understand the treatment, right? Whatever shown in is this blue color, they are the parameters which needs to be observed during the shock. Yes, you can see blood pressure, cardiac output, venous return. Here in case of heart rate, right? Here you can see oxygen pressures, right? Here cardiac output and cardiac. So these are the parameters which gives you idea about the patient conditions. We are not going into these parameters, but I have kept this to give you idea about the treatment, right? So first of the thing is that this particular condition is due to loss of volume. The first thing you should go is to treat the volume by giving fluids, right? By giving fluids. Second thing here, if apart from decrease in venous return, there will be increase in peripheral resistance also, right? Due to effect on afterload, right? So that will be covered by vasodilators. If I want to increase blood flow to the organs, I need to increase contractility of the heart. So I can give inotropic agents which will increase contractility of the heart, right? Second thing, perfusion is decreased. I can give oxygen therapy to the patient, right? Second thing, extrally I can give pressure agents and chronotropes. So this is to treat this pathology. These are the treatment options. Means this is the basic idea or the concept of giving treatment. Fluids are required, vasodilators are required, inotropes are required, and oxygen therapy is required to treat hypovolemic shock. Now we'll see each of the thing in the, you can say briefly. As I told you earlier that each individual type of shock, means with the 5 types of shocks that I have mentioned, each type of shock itself is a big topic, right? And it cannot be covered in a single lecture. So in details, of course, you will learn in the later part during medicine or surgery, but I am giving you brief idea about each and every treatment part. So first is transfusion. We are giving fluids. So in transfusion, we have options of blood and IV fluids. If hemorrhage is the etiology, then you can give blood, in which we have packed cell volume or whole blood. In IV fluids, we can give crystalloids and colloids. This particular part, transfusion, I will cover at the end of this video lecture separately, but just keep in mind that transfusion, IV fluid transfusion is the part of hypovolemic shock, right? And it will replace the fluid. Again, which type of fluid should be used, that again depend upon the etiology, that we'll see in the last part of this video. Second, I told you about inotropes. It will increase contractility of the heart. For that, you can give dopamine 2 to 3 microgram per kg per minute, right? So as you all know that dopamine acts on a D1 receptor in the kidney as well as beta 1 receptor on the heart, and it will increase the heart rate, right? Third, here to affect the afterload, you have to give vasodilator. For that, phenoxybenzamine should be given. What happens that in case of shock, when there is a fluid loss, right? So in response to that hypovolemia, there will be vasoconstriction, reflex vasoconstriction will be there. So to counteract that vasoconstrictor, we have to give this vasodilator. So phenoxybenzamine is the agent of choice for that. And of course, the patient is in hypoxia, so you have to give oxygen therapy to the patient, right? And if the patient cannot tolerate dopamine due to reflex tachycardia, right? So in that condition, you can give phenylephrine if is required. Otherwise, dopamine is the best agent. So this was in short about hypovolemic shock. Coming to next, that is cardiogenic shock. So as the name itself suggests that here the tissue is not receiving enough perfusion due to some pathology in the heart. Now again here the condition, etiology can be anything. It can be either myocardial infarction or congestive heart failure or arrhythmia or anything which due to which heart is unable to pump enough amount of the blood. That condition will lead to cardiogenic shock. So basically here you can see it is a pump which is uh, circulating blood in the whole body. So whenever there is pump failure, there will be uh, no enough supply of blood to the organs. It's simple to understand. So in that condition, there will be decreased preload and increase in afterload. So again here you have to simultaneously treat the etiology, but to improve the heart function you can choose these agents, right? Dobutamine is the preferable over the dopamine here, right? The dose is 2.5 microgram per kg per minute IV that is given, right? And it has beta 1 agonist effect on the heart, and that's how it will increase the contractility of the heart. Dopamine can also be given, and norepinephrine, right? It is can be as a last resort if dobutamine is not working. Compared to hypovolemic shock, the role of fluid will be less here. I am not saying that fluid cannot be given, but the role of fluids, IV fluids, will be less compared to hypovolemic shock. The main thing is that you have to treat that particular condition due to which cardiac failure has occurred, and meanwhile to improve the heart function you can give these agents, again depending upon the clinical condition of the patient. Third one is septic shock, right? Septic, the word itself suggests that there is some infection, and due to infection this particular condition is resulting. Now this particular condition, septic shock, mostly it is due to gram negative organisms. Gram positive organisms may, it is not that absolute thing, but most of the time the septic shock, such condition that develops due to gram negative organisms. The ultimate thing is that these organisms, when left untreated or improperly managed, or if they survive for the longer time, ultimately they will lead to capillary leakages, vasodilatation, and loss of fluids from the blood vessels, right? And that will lead to shock. So they are the series of events that occurs inside the body in case of septic shock. First, proliferation of the microbes will be there, right? And they will result in the production of some active metabolites which can lead to inflammatory reactions, and that inflammatory reactions along with the vasodilatation and endothelial damage will leak out this fluid from inside the vessels, right? And due to that there will be intravascular blood coagulations, and again there will be increase in the inflammatory reaction. So there is a series of reactions that take place, and that ultimately leads to the septic shock. So basically they are the toxins which are released by these organisms which leads to all this series of events, ultimately loss of fluid from the blood vessels and leading to the shock. Now what is the management funda of sepsis is, again there is loss of fluid in this condition, so you can give IV fluids and vasoactive agents. It is due to infection, so obviously you have to treat the infection, so give antibiotics accordingly, and to modulate host response we can give steroid therapy and vasopressin, right? So this is the overall management. We'll see individually how it works. So these are the treatment options for this septic shock, right? So first thing, of course, there is loss of fluid from the vessels, so you have to give IV fluids again. Second, to treat infection, antibiotics. Now the patient is in shock. The best thing is that you start some empirical treatment and meanwhile send the sample for the culture and sensitivity, and when the report comes, start the perfect treatment accordingly. But as the patient is in shock, empirically also you have to select some higher antibiotics which are having some broad spectrum. You cannot choose narrow spectrum because patient is in shock conditions, right? So preferred agents are meropenem, ticarcillin with clavulanic acid. These are the higher antibiotic agents you can give as an empirical treatment while waiting for the culture and sensitivity report, and once that report comes, start antibiotic accordingly. Another, these are the some newer drugs which have been tried for the septic shock. One is rotricogene alpha, right? Now this particular agent is actually anticoagulant but has been tried for treating septic shock, and by which mechanism it is helpful in shock, it has not been known clearly, but basically it is having anticoagulant action, and it is also helpful in case of septic shock also, right? And especially when the patient is in a very serious condition like multi-organ failure condition is there, and in such condition this agent can lead to improvement in the patient. Second is vasopressin. Vasopressin is basically antidiuretic hormone, right, that you will learn, but this particular agent is used when you can say that routine agents vasoconstrictor they are not helpful, and that condition this vasopressin has been proved to be effective, right? It reduces nitrous oxide synthesis and can increase the blood pressure, right? Even when adrenaline is not working, vasopressin is able to increase the blood pressure. Okay, next is steroids, corticosteroids, right? They decrease inflammatory response, they decrease prostaglandin synthesis, nitric oxide synthesis. NO is basically for vasodilatation, right? So decrease in synthesis of nitrous oxide will lead to decrease in the amount of vasodilatation in case of septic soils and septic shock, and it also decreases inflammatory response. Gynae pathophysiology you have seen that there is inflammatory, right? Here you can see inflammatory response, so that can be subsided by corticosteroids. Okay, to improve the heart function you can give inotropes like dopamine, dobutamine and adrenaline. So this is the overall treatment guideline to treat septic shock. Again, it requires very dynamic management, right? Just being like it's not a theoretical thing, right? It requires dynamic thing, simultaneously observing patient condition, simultaneously monitoring all these parameters like pulmonary capillary, wedge pressure, central venous pressure, urine output, glucose level, all should be monitored. Patient condition should be monitored because it is basically a critical condition, right? But these are the things which can be useful to treat septic shock. Okay, the fourth one is anaphylactic shock. We have learned this in some part of this in ANS, right? So basically anaphylactic shock is due to hypersensitivity reaction. Whenever a person is having some hypersensitivity to some particular agent, that will give rise to a series of reaction in the body, and that will, if sometimes it can be a minor also, but if serious kind of reaction occurs, then it can lead to a shock type of condition that is known as anaphylactic shock. So basically what happens, there is a trigger agent, it can be bite of some insect or anything, right? And it will ultimately lead to a reaction, hypersensitivity reaction, and leads to these all symptoms: fall in heart rate, low blood pressure. If reaction is mild, then patient can develop only itching and swelling, such kind of minor reaction. But in severe kind of condition, and what is life threatening in case of anaphylaxis is bronchoconstriction, right? There will be severe bronchoconstriction, and which can lead to difficulty in breathing, and if not treated, it can be, the result can be dangerous, right? So that is anaphylactic shock. What we give to treat anaphylactic shock is adrenaline, which is life-saving. You have learned this in ANS, right? Adrenaline intramuscularly or subcutaneously can save life of the patient. It will cause bronchodilation, right? And also improve the heart function. So that is life-saving. Antihistaminics and steroids can be given to suppress the immune response, the hypersensitive immune reactions and subside કરવા માટે we can give antihistaminics and glucocorticoids. So that is anaphylactic shock. And the last one is neurogenic shock. Now neurogenic shock is whenever there is damage to the spinal cord due to any condition, due to any reason. It may be due to some injury, or it may be due to spinal anesthesia, or whatever may be the reason. Whenever there is due to loss, means whenever there is damage to spinal cord, it can result in neurogenic shock. So basically what happens is that whenever there is damage to spinal cord, it will lead to loss of sympathetic reflex, right? The sympathetic tone that will be lost, and that will result in you can say over parasympathetic response, right? So due to loss of sympathetic reflex, there will be overstimulation of parasympathetic reflex, and that will lead to series of events like arterial hypotension, bradycardia and hypothermia, and that results in a shock that is known as neurogenic shock, right? And the treatment of neurogenic shock will be same as hypovolemic shock, right? Means the same fluid therapy and dopamine, and that all can be given according to the patient. And of course, if the traumatic injury has that, you have to treat that also accordingly. So that is the overall treatment about this 5 types of shock, right? Anaphylactic shock, this neurogenic shock, septic shock, hypovolemic shock, and cardiogenic shock. Again, I am telling you that this is a brief overview. Each individual type of shock is a big topic by itself. Okay. Now, as I told you earlier, that transfusion is the main part of the shock, especially in case of hypovolemic shock. So we will try to understand this particular thing, transfusion, separately. So transfusion is whenever we are infusing something in the blood vessel, that is known as transfusion. Now transfusion can be any of this. It can be blood, it can be blood products, it can be crystalloids, or it can be colloids. When we are transfusing whole blood, that is blood, these are the blood products: red cells, platelets, fresh frozen plasma, right? Cryoprecipitated. This you can transfuse to the patient individually, right? Blood and blood products are specially required in case of hemorrhagic shock, whenever there is hemorrhagic shock, depending upon the condition of the patient, right? Whole blood is the easier to get, but it has the risk of transmitting blood some disease which can be transmitted to the another person, right? Blood products, they have specific indications. Depending upon the conditions, you can transfuse. What we are focusing, this crystalloids and colloids, they are the IV fluids, right? Which are these IV fluids you will learn in specific practical also and pharmacology, but I am giving overview. These 2 types of IV fluids are there, crystalloids and colloids. Crystalloids are aqueous solutions, right? They are aqueous, means soluble in water. This type of solution, they are known as crystalloids. Normal salines, RL, Ringer's lactase, they are crystalloids. Colloids, they are not soluble in water, they are inert substance, and they are basically also known as plasma expanders. Actually, crystalloids are also plasma expanders, but we particularly use this terminology plasma expander for colloids only. So basically they are inert substance, right? They are not soluble in the water, inert substance, and which can be used to expand the volume of plasma. So albumin, dextran, the starches, gelatin, these are the colloids. So these are the agents which can be used for the transfusion purpose in case of shock, depending upon the condition. Again, to choose which kind of solution is depends upon the particular condition, right? For example, if patient, right, if patient is having traumatic brain injury, right, in such condition, if you use colloid, they will increase mortality, right? In routine condition, crystalloids are only used if normal case of hypovolemic shock is there, but in certain conditions colloids can be used. So we'll see also some details about this plasma expanders, this colloid, right, colloidal solution. So basically they are inert substance. So whenever they are given, what they will cause, due to their inert nature, they will generate osmotic pressure within the blood vessels, and due to that osmotic pressure they will prevent loss of volume from this circulation, right. You can see they will prevent, it is like sealing this loss of volume that is occurring in the circulation. So they are the inert colloids which will prevent loss of volume from the blood vessels. So they are very useful and cheaper also, except human albumin, all are cheaper. So these are the agents which are used as plasma expanders: dextran, polygelin, hetastarch, human albumin, right. There are some difference amongst this. Dextrans, there are two types, dextran 70 and dextran 40 are there. The basic thing is that it can interfere with coagulation and platelet function, otherwise it is cheaper. Polygelin, it is non-antigenic, right, it does not interfere with the grouping and cross matching, so it can be used. Hetastarch, it is not widely used because of the side effects. It can cause periorbital edema, bronchospasm, right, vomiting, chill, this kind of side effects can occur, so it is not widely used. Human albumin, it is the, you can say, ideal plasma expander, right, it is non-antigenic, it can be used irrespective of the patient blood group, no matching is required, no risk of transmitting disease, right. But the only disadvantage is that it is expensive, right. So it is expensive. So this table will give you idea about difference in these three agents: human albumin, dextran and hetastarch. Albumin is physiological but high cost, usually 4 to 5,000 નો એક injection આવે, right, human albumin નો. Dextran is causing rapid volume expansion but bleeding at high doses and allergic reaction can occur. Hetastarch is less expensive compared to albumin, but compared to dextran it is more expensive but bleeding at very high dose. So basically this plasma expanders, they are used as a substitute of these crystalloids in conditions like burns or hypovolemic or septic shock. But the only thing is that they do not, if you are giving this plasma expander, that doesn't mean that you are increasing oxygen carrying capacity, right. એ તો હિમોગ્લોબિનમાં જ હોય oxygen carrying capacity, આ બધામાં નથી હોતી. So if patient is having cardiac failure or anemia, right, or renal insufficiency, in this condition you should avoid using this plasma expander because it will increase the volume, at the same time it will not increase the oxygen carrying capacity of the blood, so they are contraindicated in such condition. Otherwise, just to prevent blood volume loss from the plasma and to increase supply volume of the blood vessels or the circulatory system, this plasma expanders can be used, right. So that's all about this treatment of shock. We have seen various types of shock, what is the basic pathophysiology of each kind of shock, and what can be the treatment, what can be the management of individual type of shock. And at the last we have seen plasma expander separately. Again telling you that shock is a very large topic, but I hope that this can give you the overall idea about the various types of shock and treatment guideline of particular shock. Hope you have learned something. Thank you.